Good morning, everybody. Today's October 15th. Best effing dad here, Dr. Vuong, with your quick COVID update. I took last week off. Felt like I didn't have anything new to say. I have something new to say now, okay? So listen up. I want to talk about, is it legal for doctors to refuse to see unvaccinated patients? But quickly, the numbers, bad in Minnesota, getting really hot in Michigan. If you live in those areas, you're in a hot spot. I would not go to football games. I would not go to concerts. Stay at home, stay separated, especially now that the weather's getting colder. You don't know if you're getting influenza, a common cold, a rhinovirus, or COVID, but you're in a hot spot up there in Wisconsin, Montana, Wyoming, still hot. Colorado, so be careful. Pennsylvania is getting hotter. New Jersey's gonna get hotter also. And upstate New York, where areas that are not as vaccinated, we're starting to really see that the larger cities that have a higher vaccination rate, they've been avoiding it so far. Obviously that's what happened in Miami this summer. Okay, so yesterday the FDA panel recommended Moderna booster at half the dose. Remember, regular dose is 100 micrograms. The booster shot would be at 50 micrograms because the power of the Moderna vaccination is not having waning effectiveness. So they said half the dose. I don't know if you need it. It's 6 months out. I probably won't get one depending on how the curve goes. If we're spiking pretty hard around Christmas or New Year's, then that's about when I would be qualified for a booster. But I'm not really immunocompromised, so I don't really have any health problems other than my allergies. And then they're going to meet today on the J&J booster, which I'm pretty sure they're going to recommend a follow-up J&J booster. There's good new data that talks about that the J&J might be better with a Moderna or a Pfizer booster. But I don't think they're going to take that topic up today. They're just going to probably recommend a J&J booster, which the data on that by itself looks pretty good. But what I want to talk about is doctors. Can doctors choose to not treat unvaccinated patients? The short answer is ethically, legally, answer is yes. Just like a restaurant can refuse you if you don't have a shirt on or sandals or flip-flops or whatever. They can receive, they can't obviously gender or, sex, race, they can't do that. But unvaccinated, answer is yes. Now there's, if it's an emergency rooms and hospitals, due to a landmark case back in the late 80s, early 90s, emergency rooms and hospitals cannot turn away patients for any reason. So like uninsured, you have to treat them. So if you are unvaccinated and you get COVID and you're sick, ER rooms have to treat you. Hospitals have to admit you if you meet criteria and if they have room. So if they don't have any beds, that's a different scenario. They'll have to try to transport you or send you to another facility that does have room. And emergency and this whole idea like, oh, well, if you get sick, don't come to the hospital, or ER doctors shouldn't treat the unvaccinated. No, we are required, doctors are required to treat anybody in an emergency case. And the idea or the conspiracy that, they should be put at the bottom of the line, that's illegal too. You have to treat in an emergency setting sick patients equally. Regardless of vaccination status or insurance status, sex, gender, race, you have to treat them all equally with all the medicines that work, okay? So in that scenario, that's where it stands in case of emergency. Now, what about a primary care doctor, a family practice doctor, an internist? And I will throw in OBGYNs too, because OBGYNs, for a lot of women, they are their primary care doctors. Do you guys remember about a month ago, there was a Alabama doctor who was refusing to see unvaccinated patients, and he was like, I'm just tired of them, they're not listening to me, and blah blah blah, like that, right? And there was I think another one in Atlanta, and they're following in line. There's one when Florida was really hot, there was a group of doctors refusing to treat unvaccinated patients. That is ethically and legally acceptable. So what you're going to see is if you choose to remain unvaccinated, and you're right, it's your choice, that you might lose your primary care doctor. The reason being is because ethically speaking, the physician will argue that, hey, the unvaccinated patient poses a threat to my staff, the other patients that are in my office. They might be immunocompromised, like maybe they're an oncology practice where pretty much everybody's immunocompromised. Maybe, pediatrics, and you have moms and dads coming in, and as of currently, kids under 12 can't be vaccinated. So it's a very good argument to say I'm trying to keep my other patients safe, and my staff safe. That's argument number one. Argument number two, everything depends on the physician-patient relationship. There are huge there's lots about the physician-patient relationship. Legal cases, medical ethics. We learn about this in med school. It's the basis of everything. And anytime a physician feels like there has been a severing or a loss of trust in the patient-physician relationship, we are legally allowed to break ties. Now, legally, I can't just fire a patient. I can fire a patient, but then what I have to do is give them names and numbers of here in Texas anyway, of 3 other physicians, same practice physicians. So in my case, it was a surgeon or a bariatric surgeon that would accept their care. But you're allowed to sever that. Now, if you are hard-headed about your vaccination status, and that's your choice, just understand you might find yourself in a situation where you lose your primary care doctor that has treated you for years, that knows your medicine, that knows your history ins and out. You might be dismissed from the entire practice or an entire group. You might have to travel to a new city or a new area of town, Now, OBGYNs, remember, the same thing applies to OBGYNs. Especially, our most litigious field is gynecology, like obstetrics, because of the risk of delivering babies. And so now you have every major OB organization, professional society recommending vaccinations for pregnant women. And the last numbers I saw was like pregnant women is one of the least vaccinated groups in America. They qualify, but the last number I looked at was like 15% of them. Only 15% of pregnant women are currently vaccinated. And the data is coming in very, very clear that the unvaccinated pregnant women are the ones that are at risk in the ICU, that are miscarrying, that are increased stillbirths. And so now every professional society is recommending vaccination for pregnant women, and you don't want to get vaccinated, or your husband's going to punch out the nurse or punch out the doctor, dude, putting yourself at risk. Be prepared to not have your OB. And it's weird because the data is very clear about the effectiveness of the vaccine, the safety of the vaccine. It comes down to misinformation, it's not a civil liberty. You have vaccinations mandates for other things, So it's going to get mandated at businesses. You're going to have to show proof of vaccination to go to restaurants, concerts, that sort of stuff. And jobs, airline pilots, airlines are requiring it. Big businesses are requiring it. Fox News requires vaccination for their employees. Fox News, guys. So the hypocrisy is all out there. But that's all I wanted to say. Just be prepared. Oh, and something else coming down the pipeline. If you are unvaccinated and you catch COVID, be prepared that your insurance company is not going to pay for your medical bills. And an ICU stay, dude, it's like $5,000 a day. And if you spend 7 days in the ICU, $35,000 just for that part. And then, you might end up with $150,000, $200,000 hospital bill when you could have just had a free vaccination. Maybe you would have been admitted to the hospital. You might be one of the 5% who gets admitted to the hospital, but your course is much milder. Recovery is much more likely, and a good treatment for long haulers. I mean, so there you go. I'll be back again, who knows when, maybe tomorrow, with another COVID update. See you guys.